squat down. That was your biggest problem before.
I was supposed to keep my knees down.
Yes.
Oh, yeah. Oh, man.
Holy cow!
Oh, yeah.
Hi, this is Dr. Robert Davis with Active Health Knee and Shoulder. I'm here with Jack, and Jack has gone through his non-surgical operation with us for his problem knee. Jack was kind enough to come on and just explain the problems that he had prior to finding us, and then the results that he noticed when he finally came into the office. So could you just tell us the problems that you're having, why you sought us out, the experience in the office after you had the procedure done, and what you were told, if you can remember all this, what you were told by other doctors. So the problem first.
Yeah, this has been long-term for me, probably going on 8 years now, and yeah, I've been getting injections for a lot of years from 2 different doctors. Initially, they were lasting a good year and were very effective, and then they became less effective, and then the doctor was reluctant to give them to me. They were becoming less effective, and then he told me the knee's basically shot. It's time for replacement, and then I retired, and because of health insurance, I sought out different health insurance and had to see a different doctor, and same thing. He gave me a few injections, and they were not so effective, and he says the knees, it's time to replace it. And then I was down here in Florida, and I
found us.
Yeah, found you guys, and says, hey, you got nothing to lose. I'm going to check this out.
Does it feel different?
It does, yeah.
Which feels different?
Just feel free.
You feel free. I'm free. Let's go up and down the stairs now, okay? Look at that.
Yeah.
And back up the stairs. All right, Jack, how are you feeling?
Wonderful. It was just amazing. And this past week, I had my son and
Grandkids.
yeah, grandkids down, 6 grandkids, and yeah, it was grandpa this, grandpa this, grandpa this. And I was just nonstop, ball energy, just having a ball with them out on the boat and in the pool, and yeah, it was just amazing. And I got my life back.
Yeah.
Yeah.
Fantastic.
Yeah.
Yeah, because I remember your big complaint was being able to just go walk on the beach and just enjoy being down here in Florida and the grandkids, keeping up with them. So I'm so happy for you. It's fantastic.
Yeah. Thanks.
Thanks for coming in.
Going from not being able to walk to meniscus growth, it's changed my life.
For me, it was immediate relief.
I was pain-free. I mean, I had no pain.
I think it took like 10 minutes, and I was better. I was walking better.
Everything is healing. It's healing your body.
If you can change the way you walk and the way your knees feel, why not try it?
This is the real deal.
Hi, I'm Dr. Robert Davis with Active Health Knee and Shoulder, and I am here today to explain how our non-surgical operation has helped hundreds of people who were previously suffering with chronic degenerative knee pain. Many of the patients that come into our office have been suffering for a long time with knee pain. They've attempted the injections, they've taken the drugs, they've had various different therapies, all done with little to no improvement. This leads their doctor to tell them that they have bone-on-bone degeneration and that their only option is to have their knee replaced. Well, I'm happy to tell you today that we do have another option. Our non-surgical operation is a neurological treatment system that resets the communication between your brain and your knee, instantly decreasing pain and inflammation, increasing strength and flexibility, increasing blood flow, and assisting in tissue healing. You see, there are 2 different nerves that are associated with the movement of your knee. One is your sciatic nerve, which branches off the bottom of your spine and runs directly into the muscle that unlocks your knee. This muscle is attached to the upper bone in your leg and the lower bone. It's called the popliteus muscle. The other muscle or the other nerve is your femoral nerve. And your femoral nerve is what powers your quadricep muscles. So every time you take a step, when you reach forward with your leg or with your foot to take a step, that femoral nerve is firing so those muscles do their job. If there is interference or if there is static along the pathway, right knee is controlled by the left side of your brain, but if there is some type of lesion or interference along this pathway, what happens is you're going to lose tone. There's going to be a state of hypotonicity. Your knee needs to unlock before it bends. If it doesn't unlock properly because there is a lesion or static along this pathway, then the bones are going to shear together. When bones shear together, that doesn't feel good. They're going to cause chronic degenerative pain, and they're also going to put stress on the supporting structures that are supporting the knee and keeping the strength of the knee. So what we do is a non-surgical operation that resets the communication between your brain, the power from your brain running down the spinal cord and getting to that knee. And that restores the strength, it restores the flexibility, it decreases pain and inflammation, and it assists in tissue healing. So if you or a loved one are suffering with chronic degenerative knee pain and you've tried the injections, you've taken the drugs, you've had the therapies done, and you still have little to no improvement, I encourage you, give our office a call. We will do a complete neurological examination for only $60, and I will be able to determine within 2 visits whether you are a good candidate for our non-surgical operation. God bless you. I look forward to meeting you, and I look forward to helping you.
Lee, let's talk about those knees. How long have you had the knee problem?
A little over a year.
Okay, have you seen any other doctors?
I've seen an orthopedic.
And what did the orthopedic do or say for you?
They repaired the meniscus in my right knee and said I have bone on bone. And the left knee he hasn't touched, but it's doing the same thing as my right knee used to.
And that he has told you bone on bone? And what is his decision to do with bone on bone?
He said eventually I'll want to have a knee replacement.
In both knees?
He hasn't said that on the left knee yet.
Okay. So what kind of challenges are you facing with the knee problem?
Well, I'm newly retired and I want to be able to travel and play with the grandchildren and just be more active because I now have the time.
Right. And you want to be pain-free. And you want to be able to do it and stay active. Well, you're at the right place. All right, so your discomfort level today we discussed from 0 to 10?
Yeah, it's probably about a 5 today.
Okay, and are you normally taking some kind of Tylenol or Advil or something?
I take Motrin a couple times a day.
A couple times a day, and you're taking it every day?
Yes.
Okay. All right, well, we got to get that so you don't have to take that any longer too. All right, Lee, I'm going to have you stand up for me. Any discomfort or any tightness or anything when you go from sitting to standing?
Not so much, no.
All right. I'm going to have you take 2 steps forward. There you are. Feet shoulder length apart. Arms straight out in front of you. And I'm going to have you squat down as low as you can go. And slowly come back up. Okay, where did you feel it there?
The top of the knees.
The top of the knees. Okay. All right, so next thing I'm going to have you do is go up and down the stairs for me. And turn around and go back up. Okay, so going up and down the stairs, which was more difficult for you, going down or coming up?
I think they were about equal.
About equal. And where were you feeling the pain and discomfort?
On the outside of the knee.
On the outside of the knee. Okay, so out of all the exercises, which one was the most difficult?
Stairs.
The stairs. The stairs was the most difficult for you. All right, you ready to get started?
Deep breath and up. Go 1, 2, keep pulling 3, 4. Hi, it's Dr. Robert Davis here with Active Health Knee and Shoulder, and I'm here with Lee, who just completed her non-surgical operation and her aftercare. So I just wanted to ask her a couple questions about her care and the problems that she had, and just to get an idea of her overall feeling of the experience here. So Lee, can you tell me the problems you were having before you came in? Like, what was going on with you? You had problems in your knees and low back?
Yep, my knees, I was having trouble walking. I was
Right.
afraid to walk through the airport, the inclines, stairs. I was icing every night. I was in a lot of pain, and I'm too young to have that
Right.
much pain.
What did you try? What did you seek out as far as to resolve the problem?
I went to the orthopedic. They did injections in my knees, both knees, and they worked for about 2 months. I went for injections again. They really didn't work. So the next step was surgery.
Okay, so when you came into my office, you were at a fork in the road, and you were either going to have surgery done, and what type of surgery were they recommending?
Knee replacement.
Oh wow, okay. And so you ended up in my office, and what was your experience? Let's go through the second visit after I did the evaluation. You had the procedure done.
Immediately I was feeling relief. It felt looser. My knees felt looser, like I could move them. And that was immediate.
Right.
And that was just the start.
She's smiling. How you feeling?
Awesome.
What changes have you noticed?
It's loose.
It's loose. You don't feel as tense and tight?
No.
How's the pain?
None.
I know you feel good, right? There you go. That's awesome.
I do.
That is awesome. Okay, let's go up and down the stairs. That was your biggest challenge, was up and down the stairs. And look at that. How are you feeling?
Better, yes.
What is the biggest thing that you notice about after Dr. Davis has done his non-surgical operation? What is the biggest thing that you're noticing?
I feel looser and more stable, actually.
So you feel like you're almost stronger?
Yes.
Perfect. That's exactly what I wanted to hear.
So then tell me some of the activities you took on that you weren't able to do for a while. What did you do within the first few weeks? Not my recommendation, but
I went jet skiing. And I'm able to walk as much as I want. I do a lot of biking. I golf a couple days in a row, which I wasn't able to do before. Even just swinging the club was hurting my knees.
Right.
So I'm a happy camper.
Excellent. And what would you tell people that, somebody like yourself that is facing, has been to the orthopedic surgeon, they've been told they need surgery, what type of advice would you give to them?
Come here.
Okay.
Going from not being able to walk to meniscus growth, it's changed my life.
For me, it was immediate relief.
I was pain-free. I mean, I had no pain.
I think it took like 10 minutes, and I was better. I was walking better.
Everything is healing. It's healing your body.
If you can change the way you walk and the way your knees feel, why not try it?
This is the real deal.
How long have you had the pain, Ann?
It's been probably a year and a half now.
And was this something that just gradually happened?
I believe it was the result of an injury I sustained in the past.
Okay.
I had a fall 4 years ago, broke my left knee.
Broke it?
I fractured the tibial plateau and shattered the meniscus.
Wow.
It's been a twist on the right knee that was unknown at the time because this was so significant.
Right.
And then also where I have worked, it might have been a bit of a work injury, working with patients. It was a difficult psychiatric patient that needed medications and a restraining. That was a lot of us as staff involved, and it was a difficult sort of, if you want to call it, the takedown.
Wow.
And I did end up on the floor. I did not think I was hurt, and I really wasn't, but I may have continued to cause more aggravation in the knee that I didn't really realize. And it was shortly after that that there was more significant discomfort in the knee, and it's progressed.
And you have pain in both knees, correct?
I do not have pain in the left knee at this time.
Just the right knee?
Correct.
Okay. All right. So I know we had discussed earlier your pain level, your discomfort level today, and you had stated that it was
It's about a 6.
About a
There's
6?
Pain in the sciatic nerve.
Okay.
Running down into the knee, and then the biggest pain is on the inner aspect.
Okay.
Of
All right.
The right knee.
Have you seen any other doctors for this?
In July, I had arthroscopic surgical procedure done because there was torn meniscus, which may very well have been from the fall. And he also took out some arthritis. Just did like a scoping.
Okay.
And at that time, I also have a Baker cyst that's good size from the irritation that's in there.
Sure.
And some ligament bruising.
Okay. But the surgery didn't help?
It did help. It did help some because he repaired the meniscus, and by taking out some of the arthritis, it has helped. However, the pain continues down the leg and up into the sciatic nerve.
Okay. All right. Well, we got to get you feeling better. All right, Ann. I'm going to have you stand up for me.
Okay.
Any discomfort when you did that?
When I have the pressure on the knee, yes.
And could you point to where the pressure is?
It's all through here.
All on the inside.
Yes.
Okay. All right. So standing there, feet shoulder length apart, arms straight out in front of you, heels stay on the ground, and squat as low as you can.
Well, I'm hitting the bench. Come out some. Okay.
Okay.
It starts getting hard right about
Right there, okay.
And it hurts the sciatic nerve as well.
Okay. So you're feeling it in your low back, and
Yep.
where are you feeling it on your knee?
Through here.
Right through there. That seems
Yep.
to be your hot
That's-
spot.
That's my spot.
Okay. All right. I am going to have you walk up and down the stairs for me if you could. I want you to hold on to the railing.
It hurts like that.
Okay. Is it so it's when it's bending?
It's the bend.
Okay.
Right in there, when I go down on the bend, right there.
Okay. Perfect. That's exactly what we can pinpoint that so
Yeah.
we know exactly
It's
what group of muscles it
Very
is.
specific right there.
All right. We're going to go back up the stairs.
Right there. It's the catch right there.
So it's when it's bending. Okay. Not when the weight is on it, but when it's
Right about-
bending.
Well, bending in the push up.
The push up.
there.
Okay.
Yep.
All right. So, Ann, out of all those exercises we did, which one causes you the most discomfort? Going up or down the stairs?
Probably going up.
Up the stairs?
Probably more
So, like when you were doing that push up?
Push up. It's
Okay.
the push up.
Okay.
Yes.
All right. Let's get you in to see Dr. Davis to get you feeling good today.
I am going to okay. You take a deep breath and pull your knee up. 1, 2, 3, 4. Keep pulling. 5, 6, 7. Good.
I get it now.
Deep breath and pull. 1, 2, 3, 4, 5. Keep pulling. 6, 7. Good. Hold that. Nice deep breath and pull. 1, 2, 3. Keep pulling. 4, 5. All the way. 6, 7. Good. Deep breath and pull. 1, 2, 3. Pull that knee up. 4, 5, 6, 7. Good. Do 2 more right here. Deep breath and pull. 1, 2, 3. Pull. 4, 5, 6, 7. Deep breath. Pull. 1, 2, 3, 4, 5, 6, 7. Okay, if you need me to stop at any time, just
That's wild.
say the word stop. Okay?
That's wild.
And we'll stop and regroup.
This feels so funny.
Yeah. So it's activating those mechanical
Holy crap. It's not bad. It's just like
It's intense.
weird.
Yeah.
All right, we're back with Ann. Ann's finished her first treatment with Dr. Davis, so let's see what you can do. Stand up for me. How was that?
A lot less pressure, less pain.
All right, let's do your squat.
Pain.
Remember, step up a couple because you can
Yep.
squat pretty low.
The pain in the knee is unbelievably better.
Because you were a 6 when we
6,
started. What do you
at
think it
least
is
a
now?
6. 1 to 2.
Okay, perfect. Let's go
Which
up and down
I'm
the
saying this
stairs.
shockingly, but like 1 to 2.
I'm not shocked because I know it happens. All right, go up
Okay,
and down
so
the
here we
stairs for
go.
me, Ann.
Oh my God. Oh my God. It's crazy good.
That's crazy good. Let's go back up.
good.
Let's go back up.
This is where the pressure would hurt.
This was the most painful.
That's maybe a 3.
Okay. It was a 6, but now it's down to a 3.
2 to 3.
Okay.
2 to 3.
All right. So what do you think, Ann?
Well worth it.
Well worth it.
Absolutely. I was told to get a total knee by many people.
And today you're going to walk out feeling really good.
I
with,
am.
with less
Yeah,
pain.
Absolutely.
We haven't even done therapies yet. Wait till we start with therapies.
This is amazing. It's amazing.
Hi, I'm Dr. Robert Davis with Active Health Knee and Shoulder, and I am here today to explain how our non-surgical operation has helped hundreds of people who were previously suffering with chronic degenerative knee pain. Many of the patients that come into our office have been suffering for a long time with knee pain. They've attempted the injections, they've taken the drugs, they've had various different therapies, all done with little to no improvement. This leads their doctor to tell them that they have bone-on-bone degeneration and that their only option is to have their knee replaced. Well, I'm happy to tell you today that we do have another option. Our non-surgical operation is a neurological treatment system that resets the communication between your brain and your knee, instantly decreasing pain and inflammation, increasing strength and flexibility, increasing blood flow, and assisting in tissue healing. You see, there are 2 different nerves that are associated with the movement of your knee. One is your sciatic nerve, which branches off the bottom of your spine and runs directly into the muscle that unlocks your knee. This muscle is attached to the upper bone in your leg and the lower bone. It's called the popliteus muscle. The other muscle is the other nerve is your femoral nerve. And your femoral nerve is what powers your quadricep muscles. So every time you take a step, when you reach forward with your leg or with your foot to take a step, that femoral nerve is firing so those muscles do their job. If there is interference or if there is static along the pathway, right knee is controlled by the left side of your brain, but if there is some type of lesion or interference along this pathway, what happens is you're going to lose tone. There's going to be a state of hypotonicity. Your knee needs to unlock before it bends. If it doesn't unlock properly because there is a lesion or static along this pathway, then the bones are going to shear together. When bones shear together, that doesn't feel good. They're going to cause chronic degenerative pain, and they're also going to put stress on the supporting structures that are supporting the knee and keeping the strength of the knee. So what we do is a non-surgical operation that resets the communication between your brain, the power from your brain running down the spinal cord and getting to that knee. And that restores the strength, it restores the flexibility, it decreases pain and inflammation, and it assists in tissue healing. So if you or a loved one are suffering with chronic degenerative knee pain and you've tried the injections, you've taken the drugs, you've had the therapies done, and you still have little to no improvement, I encourage you, give our office a call. We will do a complete neurological examination for only $60, and I will be able to determine within 2 visits whether you are a good candidate for our non-surgical operation.
Now this is where the problem arises, here.
Okay. Okay, and what kind of problem is that?
There's no strength there to carry the other foot down.
All right, Al, let's see what you got.
Much better.
Much better?
Yeah.
And try to go up without a running start.
Al, I want to thank you for coming in this morning. I really appreciate you taking the time out to come on the program. And what I'd like you to do is just explain the problems you were having before you came into the office, the experience in the office, and then maybe go over the results that you noticed after the procedure was done.
Back in July of this year, I wasn't able to walk. My wife was gone. I got out of bed one morning and fell down. And about 2 days later, I found a cane, so I started hobbling around the house. Finally, the wife returned, and I went to a specialist in Naples, and they told me I needed a full knee replacement. At that point, it was out 6 to 8 months, thank God. And I went home and researched alternatives to full knee replacements. And that's how I found Dr. Davis. I was very skeptical because it's not mainstream. We took x-rays, and Dr. Davis decided that he could help me. After the first treatment, I was able to walk out the door without a cane or pain. And after the second treatment, I was able to walk downstairs. I've been at it now. I've been treating for just over 7 months, and my meniscus had started to regenerate in my knee. It's changed my life. Going from not being able to walk to meniscus growth, it's nothing short of spectacular. So thank you.
You're very welcome. And I mean, you basically said it all. I really don't have any more questions for you. All I would ask you to do, Al, is just if people are in a similar situation, they're facing a knee replacement surgery and it feels kind of hopeless, but maybe inside they're thinking, you know what, there's got to be another option. What would you say to those people?
I would ask them to don't hesitate. Come and see Dr. Davis. You'll find the staff here very friendly, and you'll walk out on your own power without pain. That's my recommendation.
Thank you very much, Al.
Thank you.
If you're suffering with chronic degenerative knee pain, you've tried the injections, you've taken the drugs, you've had the different therapies, and you still have little to no improvement, I encourage you to take down our phone number. For only $60, we will do a complete neurological examination, and we will determine whether you are a good candidate for the non-surgical operation that we perform in our office. God bless you. I look forward to meeting you soon and helping you.